Hello, my name is Kira Hobson. Today I'm going to be doing the sterile dressing change, and throughout this video I'll be following GPSP guidelines. I'll first knock on my patient's door and introduce myself. I'll ask for 2 patient identifiers, and that could be their name and date of birth. I will then ask the patient if they have any allergies and if they're in any pain, and then if they're in pain, rate that on a scale from 0 to 10. And then if they're in pain, I would administer ordered pain medications as needed. I will wash my hands and put gloves on. I will remove this dressing using the push-pull method, starting from the outside and working my way into the middle, and I can put saline on it if needed so it's loosened. After removing, I will look at the dressing and the wound for any drainage using taco, so the type, amount, color, and odor. I will discard of this. I will then look at the wound for the size, appearance, and if there's any pain near the wound. I'll then remove my gloves and wash my hands. Then using sterile technique, I will get my sterile dressing change and my sterile gloves ready. I will open this away from me, set off to the side. I will then get my sterile gloves, making sure that they're unopened, dry, and that they're not expired. I will open this and set that down, and I'd wash my hands again. I will open away from me using the 1-inch border and not crossing the gloves. I will pick the cuff of the glove up, putting it on, keeping the glove sterile at all times, and putting above my waist. I'll set the gloves on a clean and dry area. I will step back, keeping my gloves sterile, and I will pull this back. Make sure my gloves are on. Alright, I'll then get some cleaning swabs, and I will start in the middle, and I will go up and then down, discard, get a new one, go up and down. I'll never reach over the wound, and then up and down, discard. I will then get some gauze and dry the wound. So padding, top to bottom, in the middle, top to bottom on this outer edge, and then top to bottom closest to me. I will then remove these gloves, throwing this away. I will then wash my hands again, getting a new pack of sterile gloves, making sure that they're unopened, dry, and not expired. I'll throw that away, set this down, wash my hands again, open using this 1-inch border. Open away. I'm going to set this on a clean and dry area above the waist. I'm going to pick it up with the cuff, step back, keeping my hands above the waist, stepping to the side, stepping back, making sure that they don't roll up, and then I can flip. I will then get a new dressing, and I will place on top of the wound. I will then get some tape and tape on the top and the bottom, and then I will tear off a piece of tape, write my initials, the time and date, and put in the middle. I will then remove my gloves, discard. I will wash my hands, and I will report and record.